I just had a morning filled with really awesome, successful pregnancy scans at varying points in the first trimester. And I see a lot of the same conversations happening with patients. This can be a very anxiety-provoking time. And trust me, I know firsthand from being a patient and it's experiencing the first trimester firsthand, you can be very excited about finally being at that point, but it can feel like being on an emotional tightrope. And one minute you're feeling cautiously hopeful, the next minute you're Googling every symptom and you're convinced that something is terribly wrong. So I've been there and I've seen this story play out every single day with my patients. So I wanted to talk about what to expect in early pregnancy and how we actually monitor viability of a pregnancy. First off, your symptoms are not the full story. If you're feeling nauseous, I'm always like, great, so happy you're feeling like crap. I know it's reassuring. But if you're not having nausea at this early stage, at like 6 or 7 weeks, it's completely fine. Even things like breast tenderness, fatigue, and mood swings, all of these can fluctuate and vary even within the same individual from 1 week to the next. And there are many people that feel nothing in the first trimester and go on to have perfectly healthy pregnancies. Now, I want to talk about bleeding in early pregnancy. It does not always mean that you're having a miscarriage. Trust me, I know it's scary. I bled multiple times during my first pregnancy, and I was just so convinced it was going to end in miscarriage, but I'd see a heartbeat at every scan and feel super reassured. But the culprit, which is very common, was a subchorionic hematoma. These are small pockets of blood behind the placenta, behind the implantation site. And if they're under 2 centimeters and small, they usually resolve on their own and don't raise the risk of miscarriage or bother anyone. Cramping can also be very normal because the uterus is a muscle and blood can be very irritating to the uterine cavity and it wants to get it out. So how do we actually check in on the wellness of a pregnancy? There are really 2 key ways in the early first trimester. One is hormone testing, where we look at beta hCG levels and progesterone, and then also ultrasound. When it comes to the hCG level, the pregnancy hormone, ideally you're going to see this double over 48 hours in the very early stages, but don't obsess over exact numbers. You want to see a good trend, and even a minimum rise of 53% in the hCG level over 48 hours could be a sign of a viable pregnancy. Obviously, if you're seeing a plateau in the levels or a drop, that is a more definitive sign that this is not going to go in the direction we want it to. Progesterone is another really important pregnancy hormone. It's very reassuring in early pregnancy to see levels above 15 nanograms per milliliter, anything less than 5 if your ovaries are doing this on their own and you're not in the setting of IVF where you're getting supplemented. Less than 5 is not a good sign. And in between, it's kind of equivocal and you can't really say much. Progesterone's a little confusing and tricky because we know that when the levels are low, this can be a sign that the pregnancy is not progressing as we want it to. But I think of it as most often a symptom of an early failing pregnancy that's not going well versus a cause. Because what's really driving progesterone production is the hCG being produced by the implanting embryo. And that's sending signals to the ovary, if you ovulated the egg and that's how this all happened, to continue producing more progesterone. So usually it's more of a warning sign or a symptom than the actual underlying cause. But we readily supplement progesterone to keep levels above a certain threshold. When people ovulate on their own and conceive, I'm usually trying to keep levels above 10 to be cautious. But at the end of the day, adding more progesterone to the problem isn't necessarily going to rescue every pregnancy that doesn't look like it's progressing normally. It might actually end up delaying the inevitable and prolonging uncertainty. When it comes to the gestational sac, by around 5 weeks, 5.5 weeks, we're expecting the hCG level to be at least 1,000, above 1,500. We expect to be able to actually see the gestational sac and the yolk sac at the top of the uterus. And about a week later, around 6.5 weeks, we should start to see early flicker of a heartbeat. And ideally, you want a rate of at least 100 beats per minute. The main thing you really want to make sure is that the growth is tracking normally and that the fetus, the crown rump length, the length of the fetus is measuring within a week of where you think someone's at based on the dates of their cycle, the date of their IUI or transfer. Lagging growth or failure to see development of structures or seeing the heartbeat or the heartbeat was there and then it stops, that's more definitive as a diagnosis for miscarriage. Oftentimes when I'm diagnosing whether a pregnancy looks like it's moving in the right direction or the wrong direction, I need multiple data points. This is why we're measuring over time and we're really trying to look at the big picture and get a trend. So just know that waiting and seeing is very normal. I know it's excruciating, but hang in there if you're in this phase of your life. I know how hard it is, but realize that fluctuating symptoms, mild cramps, even having a little bleeding here or there doesn't always mean that something bad is happening. You're not alone, and there's a reason that we don't want to jump to conclusions with one data point. Early pregnancy monitoring is a process, and you have to just give it time to unfold. I hope this helps.